Okay, welcome everybody to another Zoom call. We have some questions to go over, and then we'll open it up for anybody's questions. So the first question that we had somebody ask was this one. Can you explain how ursolic acid helps those with cancer? So ursolic acid has been shown in studies to help with cancer. Here's one study. This talks about breast cancer, but there's other studies with other cancers. It induces a cell called the G1, G2 arrest cell response down here. Hopefully you can see my cursor on this. And that's what helps, it helps slow the growth of cancer. So ursolic acid, if we tested that on you, so don't everybody just run out and buy ursolic acid. So if we tested it on you and that was what we said was help, something that would nutritionally help with your cancer in our thought process, then we put you on ursolic acid. So this gives you some information about ursolic acid and cancer. Now, another reason why a person would use ursolic acid that may have cancer or may not have cancer is ursolic acid has also been very helpful, shown to be helpful to block the entrance of viruses into cells. So how a virus replicates. So a virus isn't technically a living thing, meaning it can't reproduce on its own. It has to reproduce in a host cell. So when a virus enters your body, it will then attach to your cell membrane and enter into the cell membrane, and that's how it reproduces. Well, ursolic acid is shown to block the entrance of a virus into a cell, the cell membrane, thereby, so you could be exposed to a virus, and if you have adequate amount of ursolic acid, you may not get sick because when you get sick, when you're exposed to a virus, it's not the exposure of you to the virus that makes you sick. It's the fact that the virus starts to replicate in your cells that makes you sick. And if you can keep it from entering into the cell, or the majority of them from entering into the cell, you're going to certainly decrease the replication of the virus and decrease your chance that you got sick or the sickness, the virulence of the sickness in your body. So ursolic acid can be a big benefit as an antiviral agent as well. But here we're talking about anti-cancer agent, and this increases the proliferation of cancer in uh, arrest cell called the G1, G2 cell. Next question, does the Connors Clinic order blood tests for patients? If so, how can I do that? So yes, we do order blood tests for patients. However, we don't do that frequently. And the reason is that we don't bill insurance through our clinic. So it's if you still have a relationship with your local clinic, then that is one reason why you would want to keep a relationship with your local clinic, because you can get blood tests run through your insurance. Particularly if you're on Medicare or something like that, it can be very beneficial because they can be standard blood tests that can be covered depending upon your diagnosis. And if you have a cancer diagnosis, usually they'll cover, at least once a month blood tests. If your comment would be, well, I don't have insurance, so what difference does it make? I just rather have them ordered through you. Well, there still is benefit of getting blood tests from a local physician, because if it's a blood test that, like these, need a vial of blood, you need a blood draw. So if you get it from a local physician, then they can do the blood draw right there as well. We don't do blood draws. So long answer is yes, we do have blood tests, and there are some markers that you can test with a finger prick test, but we do not do insurance. So if you do have insurance and you want to run it through your insurance, it'd be wiser for you to go through a local doctor. And secondly, if you have to get a draw, if it's a test that can't be done with a finger prick test, then it may be wiser to get it done locally. But yes, we do different blood tests. We're going to talk about a few of them in the next couple slides here. What's the best cancer marker? To finish that, how would I do so? You just call the clinic, talk to your liaison or call the clinic and schedule a time for Michelle or I, and we can talk about that. What's the best cancer marker for melanoma? Well, there aren't any good cancer markers for melanoma. So if you go to this, this is just a screenshot of our blog post on tumor marker tests. So tumor markers or cancer markers are blood tests that can help give you some indication of where you're at with your cancer. Now, again, those tumor markers in that article that I wrote are listed, and here's the top 7. I left out PSA because that would be very specific, obviously, to prostate. But here's the top tumor markers that a person would run. Now, these tend to be more specific to different types of cancer, like alpha fetoprotein is certainly more specific to liver cancers and certain type of ovarian and testicular cancers. CA15-3 is going to be much more specific to breast cancers. So if I have colon cancer, would I run a CA15-3? No, I wouldn't even run that if I had colon cancer. Would I run a CA19-9? Well, possibly, because CA19-9 can be positive for pancreatic cancer, which is physically near the colon, so it's a possibility. Very common for CA19-9 for breast cancer. CA2729, this is mainly with breast cancer, also other female organ cancers. CA125, ovarian cancer, strongly positive with ovarian cancer, liver cancer, colon cancers can be CA125. That being said, if you read through all of these, there's none that are for melanoma. But that being said, would it be wise? Okay, I have melanoma. Can I run a tumor marker test that runs a lot of these? Would that be a wise thing to do? It would be a really strong shot in the dark. The chance that melanoma would show up positive on any of these would be slim, but anything is possible. So you can still run these. It's not really super expensive to run, several $100s to run, a tumor marker profile. So it may be worth doing it. If the melanoma is spread to the colon or something else, would it show in a CA125 then? Still no, it's still melanoma in the colon. It's not colon cancer. So these are different proteins that cancers can give off. So you see the CA15-3, 19-9, 27-29, and CA125 alpha fetoprotein as well can be common with breast cancer. But a person could have breast cancer and not show positive on any of these. So then what good are they? Well, in that case, they might not be any good. That's why it is good once you first have a diagnosis of cancer to have these run so you could get a baseline. Unfortunately, most oncologists don't run these on a routine basis, and there's a reason why. So most oncologists won't run these on a routine basis because these can rise and fall throughout treatment based upon a couple criteria. So let's say you were just diagnosed with a breast cancer and the oncologist did run these tests and you showed a positive 15-3, elevated above its normal range. And then the oncologist, what's the oncologist going to recommend? Of course, the oncologist is going to recommend surgery, chemotherapy, or radiation, or some combination thereof. During rapid cell lysis, so radiation is going to cause a pathological death to the cell called cell lysis. Normal programmed cell death is called apoptosis. That's like a recycling of the cells. If you go through apoptosis, you won't get a spike in a tumor marker. uh, one of these proteins won't typically spike as you go through apoptosis. But if you go through cell lysis, you can get a spike. Well, what's a cancer patient, breast cancer patient, going to do if, let's say, they do a lumpectomy to remove the tumor and start with chemotherapy? Let's say started with chemotherapy, and they do this CA15-3 again, and it goes up like dramatically. That's going to affect them emotionally, and they're going to question the efficacy of their treatment. Where in truth, it may go up dramatically because there is cancer cell lysis going on. So then the oncologist has to sit down with the patient and talk them off the cliff and explain, well, your CA15-3 has gone up. I'm pretty sure because there's cell lysis, the chemotherapy is actually working. You can see the shrinkage of the tumor. I'm very confident that we're on the right path. Don't worry about the CA15-3. Well, for that reason, a lot of oncologists just stopped running tumor marker tests. Now, typically, if you're doing natural care, you're not going to get as much cell lysis. You're going to get more stimulation of apoptosis. So your tumor markers typically won't rise. They won't spike with using the Rife and using natural therapies. They can still, but it's much less common that they will spike. We just had a person in the office today, her tumor markers, her 2729 dropped in half in 2 months. Or it was 3 months of starting care. So they're very happy. So they're using the tumor marker test, the one that was positive on her, the CA2729, to kind of monitor and gauge care. So using tumor markers can be helpful. But even when it says, okay, this tumor marker is common with breast cancer, and this one is common with pancreatic cancer, and this one is common with colon cancer, it doesn't mean that if you have colon cancer or breast cancer, pancreatic cancer, that it will even show positive. So that's another reason why some oncologists won't even run it. They're used more so with people that are not doing standards of care because they're not going to get that spike from cell lysis through natural care typically. And they can, if they do have one that shows positive, then they can use that as a monitoring device in monitoring how well they're doing with their care. But there's some cancers like melanoma that typically don't show, there's no real cancer marker tests that are good for a person with melanoma. So then how do you monitor? Well, that's the question of the day for all cancers. There isn't a perfect way to monitor any cancer. Well, I'm doing a PET scan. Well, PET scan's only going to pick up if you have 3 million cells, a mass that's 3 million cells large. Well, I got to do a CT scan. Same thing with a CT scan. You could have a completely normal CT scan, but you have multiple masses that are only 1 million cells large. So nothing is perfect. Even though something is gold standard in medicine, it's still not perfect. So that's the diff. We wish it was just we lived in a more perfect world, but we don't. More questions on blood tests. Can you order tests for omegas and vitamin Ds? Yes, we can. So this is a picture of a vitamin D blood spot test from a lab called ZRT Labs. So it's a finger prick test. So you don't have to go get a blood draw. You can do it just from home. We can send you a kit, and comes with instructions. You do a finger prick, and you blot it on a little blot paper, and you send it in, and you get a result that looks like this. A lot of hormone tests can be done like this. This can test, a blood spot can be done with a number of different tests. As far as tumor markers, you cannot do a blood spot for tumor marker test. That has to be a draw. This is a fatty acid profile with a blood spot. This is through Genova Labs. This is what they measure. There can be benefits doing a fatty acid test for some people. We haven't personally done fatty acid tests on people, omega tests on people for quite some time. These are more important with different issues other than cancer. but a fatty acid profile can be beneficial as well. So yes, we can order these tests. I don't currently have the kits for fatty acid profile. We just need to order and get a few days. We have all the ZRT kits for hormone profiles, zinc copper ratios, vitamin D tests. Um, they're not necessary, but they can give us good ideas about different things. So they can have lots of benefits to them. Next question, is it okay to have my feet on an earthing mat while running the Rife next to me during the day, or should it be done at separate times? So remember what an earthing or grounding mat slash sheet is. So this is our grounding sheet that if you're going to use this with the Rife, we just recommend you put it on the lower half of the bed. It's connected with this little button to a snap to the sheet. These are metal fibers running through the sheet. It's picking up your body. You're in contact with the metal fibers. This is plugged into the ground, the center lower part of an outlet that's connected to a copper wire that goes to your ground in your panel, your breaker panel, that is then connected to a copper wire that goes to the ground. And you are grounding yourself basically while you're sleeping. Now we do not send everybody home with a grounding sheet because there can be negatives to a grounding sheet while you're running the Rife. This is just my belief. If you fall asleep and the Rife bulb just falls onto the grounding sheet, then you're losing a lot of the frequencies. It'll prefer to go towards the ground than go through your body. Um, there's a reason why you use that rubber grounding mat when you do the foot bath, because we want the frequencies to travel up through your body to the grounding mat so that you get those frequencies from the foot bath through your body to that mat, because the frequencies are going to tend to travel to the ground. And so to answer this question, yes, it's perfectly good for you to use a grounding mat, stand on it, put it on your feet while you're running the Rife during the day. The frequencies will go through your body and down to your feet. That's just fine. It'll go through your body. So that's perfectly fine to use. You can use those together. You just don't want the bulb lying on the grounding mat or sheet, because you'll be losing most of those frequencies. Hopefully that helps. Next question. Can we get an exemption letter for masks and vaccines? And on vaccines, should we get the COVID vaccine? So the answer is yes, you can get an exemption letter for masks and vaccines. I know we have numerous patients that wear masks and have gotten the COVID vaccine. And that is your choice. I don't think it's a good choice, but that's your choice. So I am very outspoken about my belief in vaccines in general, and this COVID quote unquote vaccine is horrific. And I don't think it's a good idea. And anybody that has talked any cancer patient into getting this vaccine, saying that they're at high risk so that they should get this vaccine, should go to jail. But that's just my opinion. So yes, we will give an exemption if you choose not to get that. And I would strongly encourage that you do that. So just contact the clinic if you need that. Just email your Ann or Ashley, and we can get that to you. So if that's what you need. Typically, most mask mandates are out now, but vaccine pushes are still on full force, and you need to educate yourself. You need to educate yourself. All right, with that, we will open it up for questions. If you have a question, you can just chat that question, or again, unmute yourself if you want to speak. And again, we're being recorded, so please don't state your name unless you don't mind the world to know what your question is.
Hello, Dr. Connors.
Hello.
Yeah, my question is I'm currently taking chemo, a low dose chemo with immunotherapy, and I want to know when and how I can jump off that. And what's the safe way to jump off that and go all natural? Do we do that through? I have very good tumor markers that tell me when the cancer is in, remission, and I'm just kind of trying to do that safely, but I want to get off of the chemo immunotherapy.
Okay, we should have a conversation, you and I, and just kind of reassess everything and look at where we're going. Just call and schedule that. I won't charge you for that, but we should just talk about that separately.
Okay.
Because it is different with everybody, and that answer would not be a standard answer for
Okay.
everybody on this. So we'd want to get personal with that. So let's
All right.
do that. Just call and schedule a time tomorrow or next. Monday we're not going to be in because of 4th of July, but next Tuesday with me, and we'll chat about some different options.
Okay, great. Thank you.
So I do want to speak on that for that person. In general, can a person get off of chemotherapy, get off of immunotherapy once they start natural care? The honest answer is you could quit anything anytime you want to do it. I used to say that we live in a free country, but I'm not quite sure about that anymore. But certainly you can get off of it anytime you want, but you just want to be wise. So if the person is doing a low dose chemotherapy, then there's different possibilities of different things to do. Chemotherapies and immunotherapy are easy to just quit. But we don't want to be unwise about it if what we're doing, the chemotherapy and immunotherapy, is working and you're started using the rife and you're even getting better success. Is the better success because the rife is helping the chemo and the immunotherapy target the cancer? Now we're going to stop that. Maybe that's not the best thing to do, but we want to assess that. So we want to get personal about those questions. Everybody's different. One question that came in: how can we support and strengthen our mitochondria if we are exposed to mold? So the mitochondria are your energy producing storehouses in the cell. So your cell have these little organelles, a whole bunch of different types of organelles. One is the mitochondria that makes ATP. And how do you strengthen the mitochondria? Well, there's different things that are on the market that talk about that have different nutrition and to help strengthen the mitochondria. The biggest thing that is going to help strengthen the mitochondria is to decrease the things that are going to injure the mitochondria. The mitochondria are most injured by oxidative stress that we talked about a couple weeks ago, which are oxidizing agents. So reactive oxidizing species, reactive nitrogen species, are chemicals and toxins that damage our mitochondria of our cells, damage our cell membranes, that can be cancer causers. So antioxidants is the first thing that you think of with mitochondrial support. Um, Next question, we got a bunch coming in here. So next question, is it a good idea to avoid hydrogen peroxide? Gershon protocol recommends sterilizing the enema bucket with hydrogen peroxide. Also, I was cleaning surfaces with my students. Instead of using Lysol wipes, I use hydrogen peroxide. So I am not a fan of orally taking hydrogen peroxide, and I have a blog post on that that explains the chemistry of that. But cleaning things with hydrogen peroxide is very preferred. So yes, clean your enema bucket with hydrogen peroxide, clean surfaces with hydrogen peroxide. Use hydrogen peroxide instead of bleach instead of other cleaning products. You could use vinegar and water instead of other cleaning products. Maybe alternate those. Don't use Lysol. Don't use any of these chemicals. You realize all this COVID spray that every company is using in their restaurants and everything is so cancer causing. It's just mind blowing. I just did a podcast today with a gentleman that has you'll be able to see it in a few days when we get it up on our blog. He talks about toxins, and he pointed out something that I had never heard before. He said, in the European Union, there's over 1,300 chemicals that are banned from external use on humans, cosmetics, lotions, creams, 1,300 chemicals that are banned for use on as creams, as exfoliants, as in deodorants, on external chemicals. 1,300 that are banned. In the United States, there's 11 that are banned. So 1,300 things minus 11, so 1,289 different chemicals that are used in the United States that you're putting in lotions, chemicals, poisons on your skin, that are in deodorants, that are in makeups, that are banned in the European Union, that are approved in the United States. We are just living in a toxic slurry. So the more you can use things like hydrogen peroxide to clean with, vinegar to clean with, the much better off you're going to be. Talk about damage to mitochondria and oxidizing agents. This is what we're talking about. All these chemicals that we're exposed to that are approved by the FDA that are just poisonous to us. No wonder our cancer rate is through the roof. Next question. I am doing a coffee enema every day and loving it. There seems to be a sediment that accumulates in the tubing. Is that okay? Well, my tubing is stained brown. Yes, that's normal from the coloration of the coffee. What's the best way to clean it? Well, that leads right back to the question right before. So these people are thinking the same thing. We use Dr. Bronner's soap and hydrogen peroxide, not together. So yes, that would be a good thing to do. I would say that's just fine. Is it normal to decline a bit before getting better after quitting chemo and starting alternative therapies and detoxing? For sure. So yes. So when you are, when you're making a change and you're starting to detox the chemotherapy, it is normal to decline a lot, even long after you do chemotherapy. And I don't want to knock anybody that's doing chemotherapy, so please don't take it that way. But the chemotherapy continues to damage your liver for years, and all the detoxing in the world are still not going to get those chemicals out of your body. So make sure you're doing a lot of different. The foot bath detox, that will really help a lot. Any form of detoxification that you can do that's going to bypass your liver is going to be good. So your coffee enemas are going to be extremely beneficial for someone who has done chemo or is doing chemo. Saunas are extremely beneficial. If you don't have a sauna, it's a summer, get out and sweat as much as you possibly can so you can bypass the liver and detox through your pores, your skin. And hot packs over your liver, castor oil packs over your liver, anything you can to help detox that out of your liver, the better off you're going to be. Next question. I started using Everclear 100 proof liquor. We could stop the sentence right there and we would have a long discussion. Okay, to sterilize surfaces. Too expensive for the bucket, I thought. And I'm not a fan of using alcohol to sterilize surfaces. Alcohol, 100% alcohol has other issues to it as well. Secondly, let's talk about that just a little bit. There's things you want to clean, and you don't want an overgrowth of bacteria. You don't want an overgrowth of mold. But let's not forget that a healthy exposure to bacteria, and even a healthy exposure to mold is beneficial for your immune system. If you are not exposed to bacteria and you fall into the mental trap of thinking that we need to sterilize everything, we need to wear masks, we need to, which is totally an unsterile thing, but to think that if we lived in a sterile world, that we would not get sick, you missed the whole concept of how your immune system works. Your immune system works by being exposed to bacteria, viruses, parasites, even mold, fungus, in smaller doses on a regular basis, and different types of bacteria and viruses in smaller doses on a regular basis. Hence the benefit of allowing your children to go out and play in the dirt and play outside and be exposed to different biotoxins so that are not pathological in their virulence and in their level of dosage that they're exposed to, so that their immune system can recognize it and then develop antibodies against it, so that then that's what the definition of a healthy immune system is. So if we just lived in a sterile environment and we could somehow miraculously sterilize everything in our environment, this is what the FDA has been basically pushing, and the health associations have been pushing on us for decades, and certainly it's been a major um, consequence of what they've been trying to teach since this whole COVID scam that's been going on. That is totally contradictory to how your immune system functions. You need a healthy immune system, which is defined as having as many circulating antibodies to different types of bacteria, biotoxins, viruses as possible. That's the definition of a healthy immune system. So you don't want to create a sterile environment for yourself. You need to be exposed to coronaviruses. You need to be exposed to different bacteria. You don't want a completely sterile environment. And to think that you are sterilizing your coffee enema tube, you're not. You're cleaning it so that you don't have overgrowth of bacteria. We're not trying to sterilize anything. So do not become OCD with your cleaning habits or your sterilization habits. That can work contrary to what you're trying to do, which is trying to gain health back. So mostly sterilized piano studio, computer lab, and keyboard for the parents, that they're not freaked out over the COVID thing. Haven't been doing that lately then. Okay, good. And we need to educate people, don't we? Um, Still have a lot of people very fearful of this whole COVID thing. You're commanded scripturally to fear God and to fear Him alone. You don't fear man. You don't fear a virus. You don't fear getting sick. You don't fear dying. You don't fear cancer. That's disobedient. And we're supposed to be obedient to God and Scripture. We fear Him alone, and we trust in the Lord with all our heart. Here's our verse right here, Proverbs 3:5. And trust in Him to protect us from things. We don't act foolishly, but during the Black Plague, it was the Christians that were going in the homes of the people, risking their life, knowing full well that they could get the Black Plague and they would be dead in 3 days. They were the ones going in homes, risking their lives, helping care for people that, the rest of their family died. There was nobody caring for that person. And now we have Christians running around with masks on, not talking to people, not, living their life because they're afraid of a virus that you have a 99.97% chance of surviving. It's beyond me. It just tells you we're a state of Christianity in this country. It's just sorrowful. Um, so Sorry, I'll get off my soapbox. Any other questions that maybe don't pertain to that? So I changed my mind here. Remember, if you want to speak, you have to unmute yourself. Oop, you have to unmute yourself. I can't hear you.
I've got a lot of family and friends that have taken the COVID vaccine, and I'm very concerned about that. Is there anything they can do nutritionally or whatever?
Yes, so we had, I'm going to mute you again while I answer that. Okay, good, because it was feedback there. We had some, we have a sister site. So our website, we've taken everything off of our website that pertains to COVID, partially because, do you know who Joe Mercola, Dr. Mercola is? He got strongly attacked by Google. He actually had his site funded by Google, so he can't do Google ads or anything on his site. If you search for Mercola, it's difficult to find him. You have to go right to his site address, drmercola.com, to find him. Partly because of his stance on COVID, which was our stance on COVID, but since he's not a cancer clinic, he was putting a lot of information out about COVID, and they just basically took him down. So we were like, okay, well, that's our purpose, is not to speak so much on vaccines and COVID. We have to stay within our lane and our purpose. So we don't want that to happen to us. So let's be wise here. We have a sister site that's called My Hope for Lyme, and we had some more information on vaccines about that. On that site, but we do have a document. If any of you guys want that document, just email the clinic that you want the document on vaccines. We have several documents on vaccines, but one is how to help detoxify from vaccines. And let's see, I actually had it up here the other day. The vaccine document looks like, I can pull it up and show you right now. Well, I won't, because this will be on the live video. So just email the clinic and ask for the vaccine detoxification letter. So we've compiled some as much information that we found out there as possible. The problem with this COVID vaccine is that it's really not a vaccine. It is a messenger RNA drug, which creates an M spike protein in the cell, which is going to create havoc if this person is exposed to other coronaviruses in the future, like this fall. So there may be a lot of problems with people health-wise that were exposed to this vaccine, that took the vaccine. Can they detoxify that M spike protein? Well, there isn't any research that shows that you can, unfortunately. There are some wise things you can do to help with that and to help reduce a hyperhistamine reaction in the presence of a future exposure to other similar viruses that will initiate a histamine-like response in the cell from stimulating that M spike protein. So in that article that we compiled, that lists some of those things to do. Also, if you are unvaccinated and you're exposed to someone, you have physical contact with somebody that's vaccinated, you could actually receive that M spike protein, not through shedding, but through exposure. Whereas a virus, if you're exposed to somebody who is, or a vaccine, we're exposed to somebody who has a regular vaccine, that's called shedding. But you can still get exposure to that M spike protein, and there's numerous reports of people that have had blood clotting issues, women that started bleeding vaginally again, that have already been through menopause 5 years ago, to women who have lost their babies, just because they're exposed to people at work that were vaccinated, even though they themselves weren't vaccinated. The M spike protein can be transmitted to anybody, any unvaccinated person from a vaccinated person. There could be danger. There's belief that using different pine needles, evergreen needle tea can be helpful with M spike protein. There's other nutritional things that a person could do and herbal things that a person could do to help with the M spike protein. That's in that document, so just request that document. We took that off of our website just because we're a cancer clinic, not a vaccine clinic, and we just thought it'd be a disservice to our patients to have our website go down because of that. So just request that personally, and we'll give you that information personally that can help those people and help you. All right, any other questions? Well, we had a good little Zoom call today. I just thoroughly offended half you that are pro-vaccine, so I apologize for that. No, I don't. I don't apologize. That's my opinion, and you can throw it out the window if you want, but I feel very strongly about that, and I know other people feel very strongly on the other side, and that's okay, and we can agree to disagree. All right, no more questions coming in. We will bid adieu. And again, if you have questions that you think of during the week, please email those to us. And oh, here's a nice comment. Just a comment, thanks to you and your staff, I've lived 1,350 days longer than the first doctor said I would. Well, praise God for that. And thank you for being thankful. And I know you are thankful to the Lord first. But we thank each other because we're a team and a family, and we love each other, and we're praying for each other. So thanks everybody who's prayed for everybody else. And I would really encourage you to become a prayer warrior. If you feel like you lost your way or you've lost your purpose in life, make that to be a prayer warrior for others. That will be well served. Okay, somebody popped in a video chat. If you do have a question, you're going to have to unmute yourself. Nope. All right. Well, thank you, everybody. We will say goodbye and talk to everybody next week.